Good morning, everybody. I talk about Guillain-Barré syndrome associated with SARS-CoV-2. Definition. The disease caused by severe acute respiratory syndrome by coronavirus SARS-CoV-2 was named coronavirus disease 2019. COVID-19 has affected more than 10 million people to date, declared a pandemic by WHO on March 11, 2020. The clinical spectrum of COVID-19 varies from asymptomatic patients to patients with severe respiratory failure and even multi-organ and systemic disturbance. However, SARS-CoV-2 can affect a wide variety of tissues, manifesting in an extensive range of symptoms, including neurological manifestations. This may be explained by its possible neurotropic potential and our molecular marker with immunological cross-reactivity. Alteration of peripheral nerves have been reported, leading to different pathological manifestations. Among these, Guillain-Barré syndrome (GBS) has been reported in multiple cases. To our knowledge, 29 cases of GBS associated with COVID-19 have been described. Most of the cases have been on post-infections presentations and with absence of anti-gangiocyte antibodies, and SARS-CoV-2 has not been detected in cerebrospinal fluid and in any of them.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be going through Guillain-Barré syndrome, and you can find written notes on this topic at ZeroToFinals.com/Guillain-Barré or in the neurology section of the Zero to Finals medicine book. So let's jump straight in. Guillain-Barré syndrome is an acute paralytic polyneuropathy, and it affects the peripheral nervous system. And it causes an acute, meaning quite quick, onset, symmetrical, affecting both sides equally, ascending weakness, so it's weakness that is coming up from the feet upwards. It can also affect the sensory nerves, causing a sensory neuropathy. It's usually triggered by an infection and is particularly associated with gastroenteritis caused by Campylobacter jejuni, or infection with cytomegalovirus or Epstein-Barr virus. So what's the pathophysiology? Guillain-Barré is thought to occur due to a process called molecular mimicry, and this is where the B cells of the immune system create antibodies against the antigens on the pathogen that's causing the preceding infection. So if they've got a Campylobacter gastroenteritis, the B cells of the immune system create antibodies against that Campylobacter. And these antibodies also match proteins on the nerve cells. They may target proteins on the myelin sheath of the motor nerve or on the nerve axon itself. And this damage to the nerve cells, because of these antibodies against the nerve cells, create the neuropathy and the symptoms. So how does Guillain-Barré syndrome present? Well, it presents with a symmetrical ascending weakness, which starts from the feet and moves up the body. There will be reduced reflexes, because it's a peripheral neuropathy. There may be peripheral loss of sensation or neuropathic pain, and it may progress to the cranial nerves and cause a facial nerve weakness as well. So what's the clinical course? Well, symptoms usually start within 4 weeks of the preceding infection. So they may, in your exams, have had a gastroenteritis 4 weeks previously. The symptoms typically start in the feet and progress upwards, and the symptoms peak within 2 to 4 weeks, and then there's a slow recovery period that can last months to years. How do you make a diagnosis? Well, a diagnosis of Guillain-Barré syndrome is made clinically. There's no specific test that confirms the definitive diagnosis. There's some criteria called the Brighton criteria that can be used for a diagnosis, and it can be supported by investigations such as nerve conduction studies, which show reduced signal throughout the nerves, and lumbar puncture to test for the CSF. And in your exams, the CSF of somebody with Guillain-Barré may have raised protein with a normal cell count and normal glucose. Let's talk about the management of Guillain-Barré. It involves IV immunoglobulins, plasma exchange to try and remove some of those antibodies, supportive care to make sure the patient is still well despite having the associated weakness, and importantly, they need venous thromboembolism prophylaxis, so maybe low molecular weight heparin or enoxaparin to prevent them from developing blood clots, because pulmonary embolism is a leading cause of death in Guillain-Barré syndrome. In very severe cases where there's respiratory failure, then the patients may need intubation, ventilation, and admission to the intensive care unit. Finally, let's go through the prognosis. These are rough numbers, but around 80% of people will fully recover. 15% will be left with some sort of neurological disability, maybe some slight weakness or some neuropathic pain, and 5% of patients will actually die from the condition. Thank you for watching this video. If you liked the video, left a comment or subscribe to the channel.
Applications in medicine. The most common manifestations of COVID-19 are fever, gout, dyspnea, pneumonia, and respiratory complications. However, gastrointestinal and neurological manifestations have also been described. Neurological symptoms are present in about 57% of patients, including mild symptoms such as anosmia, dysgeusia, myalgia, and headache, which appear early in disease, and other symptoms that usually appear in patients with more advanced disease associated with moderate observed infections. Altered level of consciousness, confusion, seizures, cerebral infarction, and encephalitis. Guillain-Barré syndrome, GBS, in acute inflammatory polyradical neuropathy, and is the most common cause of flaccid paralysis worldwide. Patients with GBS typically present with painful paresthesias and ascending symmetric weakness, with reduced or absence of osteoteninosus reflex. Patients may also have cranial nerve involvement and respiratory muscular weakness.
Hi, what is the relationship between COVID-19 and Guillain-Barré syndrome? And are COVID vaccines safe in patients who had Guillain-Barré syndrome? I will answer all those questions. This is your neurologist, Dr. Omar Dannoun. So what is Guillain-Barré syndrome? So Guillain-Barré syndrome, or GBS, is an autoimmune condition where the immune system attacks the nerve covering called myelin cells, and those myelin sheets are covering the nerve and facilitate the electrical conduction. So what are the symptoms of Guillain-Barré syndrome? So the Guillain-Barré syndrome starts as numbness and tingling in the peripheries, usually in the extremities, hands and feet, and usually that marches up more to the whole arm and leg, and even more, and is associated with also weakness that starts distally in the periphery and then usually marches more, and in severe cases it can affect the breathing muscles. So what causes Guillain-Barré syndrome? The cause of Guillain-Barré syndrome so far is not clearly known. However, it has been associated and seen after an infection, usually viral or bacterial, that affects the gastrointestinal system, and it happens after a few weeks of the infection, and it has been seen in many cases after COVID-19 infection. Are COVID vaccines safe in patients who had Guillain-Barré syndrome? The answer is yes. We have so far no evidence that there is any increased risk or complications from the COVID vaccine in patients who had Guillain-Barré syndrome, or in general if the COVID vaccine can induce Guillain-Barré syndrome. So far the vaccines are safe and effective. And what vaccine should I take if I had Guillain-Barré syndrome? The answer is that you should take any vaccine that is available in your area, and you do not wait for another vaccine to come, because they're all safe and effective. If you like this video, please hit like.
Pros and cons. Pros. The classic pathophysiology of neural damage seen in GBS is the post-infection's autoimmune mechanism. In COVID-19, what favors the possibility of these mechanisms is the absence of virus in the cerebrospinal fluid. Of most described patients with GBS and the parental beneficial response to intravenous immunoglobulin. Cons. The prevalence of GBS associated with COVID-19 infections is still unknown, and it's possible that not only patients with mild symptoms of GBS may go undiagnosed, but there is also a risk that severely affected patients may be mistaken for having a polyneuropathy of the critical in patients. Issue applying in Ecuador. In Ecuador, neurological events are very rarely. Incidence rate 5.4 per 100 million thus case of neurological case of Guillain-Barré. Guillain-Barré syndrome after vaccination with AstraZeneca. Healthcare professionals should be alert to signs of symptoms of GBS to ensure a correct diagnosis. To initiate and prepare supportive care and the treatment and the rule or other cause. Conclusions. The prevalence of GBS associated with COVID-19 infections is still unknown, and it's possible that not only patients with mild symptoms of GBS may go undiagnosed, but there is also a risk that severely affected patients may be mistaken for having a polyneuropathy of the critically in patients. However, GBS in patients with SARS-CoV-2 infections closely resembles clinical and electrophysiological decreasing force. Further studies are not needed to understand whether the frequency of GBS actually increased due to COVID-19 infections and to explore pathogenic mechanisms. Neurologists should consider testing on patients with GBS for COVID-19, as they may be asymptomatic or not present with classical respiratory symptoms.
New at 5, as we keep learning more about coronavirus, doctors now say it can also affect a person's nervous system. Doctors here in Pittsburgh were the first in the country to make the discovery. Dr. Maria Simbra explains how they made the connection in a local man with COVID-19.
In all of the United States, the first documented coronavirus-related case was in a Pittsburgh hospital, a nerve problem called Guillain-Barré syndrome. It typically happens after a viral illness. The immune response attacks the nerves.
This results in progressive weakness, loss of sensations, and in some cases it progresses to the point where patients have trouble breathing.
The patient was a 54-year-old contractor who started getting sick just after his wife was diagnosed with COVID-19.
He was having difficulty breathing, he was running fevers.
He did have the infection with pneumonia and something else.
While he was being treated for his COVID, they noticed that he was getting weaker in his extremities. The patient did have the very characteristic features of Guillain-Barré syndrome.
He was weak, and when doctors tapped with a reflex hammer, no response. His nerve tests and spinal fluid were abnormal and showed he had Guillain-Barré. He ended up on a breathing machine.
He had the dual problems of COVID infecting his lungs and the weakness of Guillain-Barré.
The doctors gave him the standard therapy for this, intravenous antibodies called IVIG. He got off the ventilator, started rehab for the weakness, and gradually improved. Usually, Guillain-Barré happens several weeks after an illness.
This is something unique about COVID-19, that the Guillain-Barré in COVID-19 tends to occur fairly rapidly.
In fact, the same pattern happened in a